Meanwhile, to improve medical healthcare in Nigeria, a newly opened medical center has hosted a symposium showcasing cutting-edge nuclear medicine technologies that can diagnose and treat cancer-related diseases. We have details in this report.
Nigerians are familiar with the word or medical practice called nuclear medicine. Is a medical specialty used to diagnose and treat diseases in a safe and painless way. In February this year, the Nigerian Nuclear Regulatory Authority revealed that although Nigeria has only 14 radiotherapy centers, there are no functional gamma cameras to serve its 216 million population. That story is gradually changing.
Patients are labeled by default. Oh, you have knee pain, you have joint pain, you have osteoarthritis. But you see, by labeling it by default, you're not treating it appropriately and effectively. So you end up with chronic patients and eventually patients with disabilities. So nuclear medicine is a game changer. When we are able to inject into the joint of a patient, number one, it is minimally invasive. Number two, we are actually promoting the cells to completely restore that joint. So we actually delay and prevent patients from having joint replacement surgery, which on its own carries great complications and side effects.
A bit new, some of the interventions are, some of them are novel, and there's a lot of challenge really in running a nuclear medicine facility. Not only in terms of expertise, in terms of the professionals, you're also talking about having to get the isotopes. Of course, you have to get a regulatory approval to be able to bring in the radioactive isotopes that we use in nuclear is utilized in nuclear medicine. But aside from that, because our country does not have what it takes at this moment to produce those isotopes, right? You have to then bring in those things. All right, having been approved to do so, you bring in those things from outside the country. That can pose a challenge.
This development brings quality diagnosis of cancer and personalized treatment for Nigerians.
People with what is known as chemotherapy, you know the kind of side effects because it attacks all fast-growing cells at the same time. But this one only goes for cells that are inflamed or cells that are mitotic. So it just goes to the local area where the problem is and deals with it. So much cheaper, fewer side effects, minimal hospital stay, long resolution. We're treating things like thyroid disease, we're treating things like cancers. Right now it has been very well tried with prostate cancer and it's very, very good. So it is a game changer for arthritis.
Although Nigeria still has a long way to go in maximizing nuclear medicine treatments in its health sector, this initiative shows that world-class medical care is not far from sight.